Many people say they're not sure what the current rules are when it comes to isolating if you test positive for the virus or think you may have been exposed. Our Gillian Neff with an insight from health officials.
Health officials say the current dominant strain of coronavirus is a subvariant of Omicron. It's not as mild as that original Omicron, and it's rampant in our region right now.
We have a lot of infections. It's continuing to rise, and I expect that number will continue to rise in the days and weeks ahead.
In areas where community levels are high, everyone should be using prevention measures and wearing a mask in public indoor settings.
If you do test positive, whether with an at-home test or PCR test, experts say to isolate immediately at home. Go to a room away from others. If the results come back while you're working, put on a high-quality mask like an N95 until you get home. How long should you isolate for? Health officials say at least 5 days. Day 1 is 24 hours after the positive test or appearance of symptoms. That means not being in the same room with others, not going into work, and wearing a well-fitting mask while in common areas. Open the windows as much as possible. And after the 5th day, the CDC says if you have no fever and symptoms are improving, you can go into public places with a well-fitting mask. But some schools and workplaces may have their own policies. The CDC says an infected person should still wear a mask around others, even at home, through day 10. As for when you test positive, health officials recommend you reach out to a doctor. See if you're eligible for therapeutics meant to be taken before someone gets severely sick. There are antiviral pills which can be taken at home. There are also 2 types of injection or infusions for those at higher risk. Doctors say the sooner you start them, the more effective they'll be.
I'm health reporter Gillian Neff, and that's your News 12 Health Report.